Hi, my name's Laura Wasson, and today I will be speaking with you about the topic of telehealth. So, first of all, what is telehealth? Telehealth is the use of digital information and communication technologies, such as computers and mobile devices, to access healthcare services remotely and manage your healthcare. So, there's a few different types of telehealth. The first one is live video. So I think this is what most of us think of when we think of telehealth, kind of the teledoctors. So this is real-time, two-way interactions. An example is a patient to provider or provider to provider. The second is store and forward, where data is collected, recorded, and sent to a provider. And this might include the patient's medical and health data. The third is remote patient monitoring. So this is where medical data is collected and transferred to a provider who monitors the data for changes. An example of this is maybe a rehabilitation facility or elderly client care. And the fourth is mobile health. So this is where health information is supported by cell phones and computers. And an example of this is text message reminders for an appointment. So to go into the details a little bit, live video is, again, what I mentioned, what most of us probably think of as telehealth, where a patient's able to speak with a doctor remotely through their phone or their computer. Sometimes it's with video or sometimes it's just with audio. But if they're sick, they can call in and the doctor can actually look at them or listen to their symptoms and prescribe a medicine. So the benefits to this is that most of the services are open 24/7. So if you are in a lot of pain or you have a really bad UTI, you can call at any time and get your medication right away. So obviously this can prevent ER trips or trips to urgent care if you have these illnesses after hours, which often saves money. So this is only used for limited common health issues, so colds, flu, rashes, skin infections, UTIs, stuff like that, things that they can maybe visually see or that are really common that you can describe your symptoms. They wouldn't use this for like strep throat or things where you need to be tested. And seeing a teledoctor usually costs around $45. It's typically about $100 at a doctor's office, $160 at urgent care, and $750 and up at the ER. So I actually had to use this when I was on vacation one time. We went to Asheville, North Carolina, and we were up in the mountains, and I had a really bad ear infection, inner ear infection. And so every time we drove over a big hill, my ears would pop and they just hurt really bad. So I woke up in the middle of the night and decided I wanted to take care of it so I could enjoy the rest of my vacation. And so I signed up, and within 15 minutes, a physician had called me with video chat, and they had me film, so kind of ear, nose, throat, so they could see if there's like post-nasal drip and stuff like that. And then they were able to prescribe medication. So another form of live video is where the physician can consult with other physicians about their tough cases. So I read an article about how Doctors Without Borders uses this about 5 to 10 times per day, because in less developed countries, it's hard to come by medical expertise. And this way, they're able to communicate with specialists all over the world. So in looking at Store and Forward, that's where a patient's digital health history file which may include x-rays and notes, things like that, are securely transmitted electronically to evaluate their case. So this is primarily used among medical professionals to aid in diagnosis. So they're able to send these notes or these x-rays or scans to another medical professional to look at whenever they have the time to do it. So a positive of this is that need for coordinating schedules is removed, unlike for the face-to-face or live video consultations. Remote patient monitoring is another interesting thing. I read about a Mercy hospital that had a tele-ICU, and that's where the critical care doctors monitored the ICU patient's data remotely. And so these doctors had access to information. It's recording information about their heart rate, their blood pressure, maybe their level of oxygen. And although the doctor isn't in the room there, if something changes, they're able to communicate with the nurse to let them know that something needs to be done. So ICUs monitored by Mercy via tele-ICU actually saw a 35% decrease in the patient's length of stay and 30% fewer deaths than they had anticipated. And then mobile health, a lot of us use that. So there's apps, there's patient portals. It allows the patient to see their test results, often before you even have your doctor's appointment. So I've had some scans done where as soon as the doctor receives the results, their office has uploaded the results to patient portals, and then you don't have to worry. You know right away if your leg's broken or not, and then you can call if you want to speak to the doctor or see them sooner. It also allows patients to message their doctors with questions or prescription refill requests. Personally, I think this is great if you're in the workplace and you don't really have a private place to go to either call your doctor with questions or call to try to get a new prescription refill. This way at lunch, you can just get on your computer and send them a message. It's very private. It also gives summaries of previous visits. So if your doctor's made a mistake in entering any of the information or your symptoms, the patient gets to see that, and you can let your doctor know that something's wrong. An example of this, I went to the doctor and I saw one of my summaries of my previous visit, and they'd entered my height as 5'2", even though I'm 5'7". And in that case, it's not a big deal. But with things like diagnoses, you kind of want to see if they screw up. You can also schedule your appointments, and you can get appointment reminders, which is great. So how do patients actually feel about virtual healthcare? 61% are open to using them, but only 16% have done so as of May 2016. Benefits of telehealth. There's so many benefits of this. So it costs less than a trip to the doctor, urgent care, and emergency room. Prevents a patient from being exposed to illnesses at the doctor's office. I know when I was a kid and I was sick and I had to go to the doctor's office, my mom would always joke that either I would bring something else home a couple days later, or she would wind up sick from taking me into an office full of sick kids. So this is a great way to stop the spread of illness. It's accessible to people in rural or isolated areas where doctors are really far away from them. It's convenient for people with limited time, mobility, or transportation. And it's accessible 24/7, which often prevents the patient from having to go to the ER after normal office hours. So this poll actually rates the benefits of telehealth. So 59% said that convenience is the top benefit. 40% said potential cost savings. 35% said ease of prescription refills. and 26% said more frequent communication with healthcare professionals. So what are some of the concerns with telehealth? I read a JAMA dermatology study that said that only 32% of teledoctors discuss potential side effects of medications they prescribe, and they were concerned that we're sacrificing quality for convenience. But I'd also argue to that my doctors in a doctor's office rarely discuss those potential side effects too. So it might be good to compare the two. It's limited in types of illnesses they can treat. Like I said before, they can't treat strep throat or things where they need a test for certain strains. The data may not be secure. That would probably be one of my big concerns with this is my health information secure and well protected? You might lose personal relationships. You're not likely to have the same doctor, so maybe they're less likely to be familiar with your previous health issues. And then state licensing is a big concern. As of January 2015, 47 state boards require physicians to be licensed in the state that the patient is located in. So that complicates the telehealth a little bit. Concerns with telehealth. So again, they ranked the major concerns here. So 43% are worried insurance won't cover it. 37% that the data might not be secure. 35% about losing personal relationship with the provider. And 34% were concerned with internet connection issues. So what does the future of telehealth look like? It's predicted that the global telehealth market will reach $36.3 billion by 2020. We're also looking at a lot of companies that are trying to come out with telehealth purpose home kits that would cover the tests for illnesses where you actually need a kit to test for it. So strep throat, sometimes UTIs, etc. Wearable health device information that could be sent straight to your doctor. Doctors' offices may start to offer appointments via phone or video to compete with teledoctor services. I actually think that that'll come in the next couple of years because I do think that the teledoctors will take off and that normal doctors' offices will need to compete. Teledoctors will prescribe medications and pharmacies will deliver certain non-controlled medications to the patient's home. That's kind of my personal prediction here. I didn't read anything that supported that, but I think our generation loves convenience. So to have a pharmacy that delivers medication to your home, I would love it. And also more laws will need to be implemented to protect patients' privacy. So some questions for you. One, have you used telehealth technology before? If so, what are some improvements that you would suggest? If you haven't used it before, would you in the future? Where do you see this technology in 10 years? What are your biggest concerns with this technology? And do the benefits outweigh your concerns? So thanks for tuning in and listening to my talk about telehealth. Here are my references, and I hope you have a great weekend.